known in the name of Khushhali Group. I would like to indicate towards Professor Dr. Sanjay Gupta ji. Professor Sanjay Gupta is a well-known psychiatrist, and he is a professor in the department of psychiatry, Indian Institute of Medical Sciences, Banaras Hindu University. With these words, I would like to invite Professor Dr. Sanjay Gupta for his deliberations. His deliberation, the topic he has chosen, the state of pandemic and way of happiness. Naturally, this lecture will be very fruitful. With these words, I would like to invite Professor Sanjay Gupta ji.
Distinguished delegates, experts, distinguished guests, ladies and gentlemen. At the outset, I'd like to congratulate the Law School of the Banaras Hindu University for organizing this national webinar on law relating to pandemic and health services in India. It is a privilege to be with you in this national webinar to speak a few words on health in this pandemic. At the outset, my sincere regards to the Honorable Vice Chancellor, Banaras Hindu University, revered Professor Rakesh Bhatnagar, a distinguished expert, internationally acclaimed. Also, I'd like to pay my regards to the Director, R.P. Raisa. I'm happy to share this platform with illustrious speakers, Professor S. Shivakumar Sir and Professor B.C. Nirmal, Professor C.P. Upadhyay, Dr. Upadhyay, and many others. So at the outset, I will be speaking on keeping good health and resiliency in these times of this COVID-19 pandemic. Now, as of 24th May 2020, the Ministry of Health and Family Welfare had confirmed a case total of 131,868, with 54,441 recovering and 3,867 deaths. India was at that time the fourth largest number in confirmed cases in Asia, and the number of cases breached the 1 lakh mark on 19th May 2020. But the India's case fatality rate is relatively lower at 3.09% against the global 6.63 as of 20th May 2020. And about half of all of the reported cases of India belong to 6 cities of India, such as the pandemic. Now this pandemic, the law and the health. Yes, this is a law webinar on the pandemic, and the right to health is a law under the Article 21, as you all know, fundamental right. This pandemic is taking a full toll on the people. There are so many responses to COVID. The common responses are, first of all, the work pattern has totally been shattered. Now you are stay home, stay safe, and work from home. But there is a fear of not being able to work, being dismissed from the work, and losing the income. And suppose you go into isolation, then you won't be able to work. Then you don't know anything about this, and you're helpless because there are no medicines or no vaccination till now. So that feeling of being powerless to protect the family and the fear of loved ones dying because of the virus and you being helpless about it. The fear of getting ill is, of course, very, very rampant. There is also a fear of going to the hospital. People are trying to avoid going to the hospital or healthcare facilities due to the fear that they will become infected. Such is the infectivity. The fear of being placed in quarantine. If you are moving, if you are traveling, then there are comments that you have to be in quarantine, maybe home quarantine or maybe authorities based quarantine. The fear of being placed in a quarantine due to association with the disease and then being socially excluded, socially isolated. That perception is weighing heavily on the minds of the people. The fear that the quarantine will separate them from the loved ones and their caregivers is also there. Due to the isolation, there's tremendous feelings of depression, helplessness, boredom, loneliness. The patients or the caregivers, they are in isolation or quarantine due to the fear of the infection, and consequently they cannot take care of the family members. So that is also a problem. Then the PTSD, the post-trauma stress, that is the fear of reliving the experience of this epidemic later on. So this insecurity leads to a lot of aggression. And so came the Act, the Epidemic Diseases Amendment Ordinance 2020, because there was tremendous insecurity for all of these reasons, and consequently the people would get aggressive against the healthcare workers. Now, health, as we know, the WHO has defined health as not just being the absence of a disease. So we say that the person is not diseased, but in health, it should be a state of complete physical, mental, and social well-being. And this COVID crisis is taking a big toll on the mental well-being, physical well-being, and there is a lot of strain. Like we said, the stigma, the shame, the guilt over quarantine, over isolation, the overwhelming fear for the health, the concept of spreading the infection to the family members, a loss of privacy due to the media reporting your COVID positive status and other things. The routines are being totally disrupted, and so people are becoming frustrated, they're becoming short-tempered, and many people are losing their loved ones. Yes. So bereavement is leading to depression. The risk of being infected and infecting others is especially more because the mode of transmission is not completely clear. The other aspects are at the community level. There is tremendous distrust towards the other individuals in terms of disease spread, and also towards the government and to the healthcare services in terms of their capability to manage this outbreak. And so you found so many aggressive outbursts against the healthcare workers. Again, the closure of the community services and the collapse of the industries negatively impacted the economy, with a lot of people facing financial losses and risking unemployment, which further intensified the negative emotions already experienced by the individuals due to the COVID pandemic. All these emotions can be amplified by pre-existing depressive and anxiety disorders, which contributes to the increased rumination of contracting the disease, and this can profoundly remodel the people's behavior and social interaction with others. The psychological responses could affect a person's particular health-seeking behavior also. The feelings of helplessness and anxiety can motivate some people to use unproven methods and remedies that may have detrimental effects. So infodemic associated, so many people, they are feeling that if I eat this, I will prevent myself from getting the infection, and all which is not from trustworthy sources. The cases of domestic violence, the social distancing, which is part of the preventive strategy, this can result in further isolation in an abusive home. Abuse is likely aggravated during this time of economic uncertainty and distress. Domestic violence and increased rates of child abuse, neglect, and exploitation have been reported earlier also in various epidemics, and so much so for this one. Overall, the family stresses can increase due to the parental unemployment or to the loss of the household income. With regards to health morbidity, there can be significant psychiatric conditions varying from depression, anxiety, panic attacks, somatic symptoms, and post-traumatic stress disorder to even delirium psychosis, even suicidality, which could be associated with the younger age and an increased self-blame tendency. The very important concept is females have been reported to experience a higher degree of the psychological impact of the outbreak, such as stress, anxiety, and depression. And so this women being at elevated risk of depression could could be possibly due to their unique biological, socio-economic factors, but this is a pressing need to be intervened on because it is the woman who is primarily looking after the family. There are so many others except women who are at risk. Of course, we know about the foreigners under quarantine or in isolation in hospitals. They are at increased risk of psychiatric issues as they are deprived of their social supports, and there's risk and very much uncertainty about the repatriation process. The older adults are also at risk. As we have seen, the healthcare workers on the front lines, they have very heavy viral workloads. So the risk of infection is particularly very, very high there. Internationally also, we have seen that from nations to nations, there is a lot of conflict. There is stigma and blame targeted at communities affected by the outbreak by other countries. And this is impeding even cross-nation trades. The blames are coming in that this country is to blame or this country is to blame. So even internationally, there is tremendous conflict. The health workforce are the frontline soldiers, and with regard to this, the ordinance amendment that has come is something which was a pressing need, and that is very, very welcome. And it's very, very nice that the government has taken this measure right in time. It shows that the government is proactive, augurs well for the country. So what do we do about all of this stress? We've seen a whole lot of stress. What do we do about this stress management? Well, there are a lot of determinants of health which we can focus on. And there are things called determinants of health. There are a number of factors which are known to influence the health status of individuals, including their background, lifestyle, economic, social conditions, spirituality, and these all can be modified. The special thing about the children and the environment, firstly, the children, the stress management is very, very important because the disruption in the routine has been very, very stressful for them. So for the children, you encourage them to actively listen and have an understanding attitude, enable them to express and communicate their disturbing feelings. They may have disturbing feelings, yes. Enable them to express and communicate these feelings in an environment that is safe, supportive, sensitive, and caring. Create opportunities for these children to play, to be physically active, and to relax. Create a routine, a newer routine, which can go along with the new times. A acronym DEP will get rid of your depression. The D stands for डटे रहो. आप डटे रहेंगे तो कोरोना को मात दे देंगे. Yes, डटे रहिए. E से engage रहो. Engage रहो. You have a lot of hobbies. You have unfulfilled desires. You have a lot of talents which were yours. You had some work assignments which were pending. You had some household काम थे, वो pending थे. आप कहते थे भागम भाग की जिंदगी में मेरे पास समय नहीं. तो अब समय है आपके पास. अब आप इस सब को कर सकते हैं. एंड ये एंगेज रहिए. काम भी आपका पेंडिंग काम खत्म हो जाएगा, स्ट्रेस और कम हो जाएगा. और पी से पॉजिटिव थिंकिंग. पॉजिटिव थिंकिंग really is important because once you think positive, you will do positive things. And once you do negative things, once you act wrongly, that shows that you are thinking negatively. Also, have a positive circle of friends around you which you can associate with. The other acronym to remember for stress management is SAFE. SAFE. SAFE से sanitizers रखिए, सोशल डिस्टेंसिंग रखिए, मास्क रखिए. शेड्यूल अपना बनाइए, अपने रेगुलर रूटीन को प्रमोट करिए. शेड्यूल अपना नया नया बनाइए क्योंकि नया एनवायरनमेंट है, नए डिसिप्लिन्स हैं, तो नया नया शेड्यूल बनाइए. और एक और एस है सोशल मीडिया. सोशल मीडिया को यूटिलाइज करिए फॉर सोशलाइजिंग. आप लोगों से नहीं मिल सकते हैं, कोई बात नहीं. सोशल मीडिया इज फॉर सोशलाइजिंग. इट्स वेरी इफेक्टिव, वेरी सेफ मेथड, लेकिन उसको भी डिसिप्लिन की तरीके से करिए. तो ये एस से सैनिटाइजेशन हुआ, शेड्यूलिंग हुई, और सोशल मीडिया से सोशलाइजिंग हुई. ए से ऑथेंटिक न्यूज. False news has become an infodemic. और ये बहुत ही खतरनाक है। डोंट स्प्रेड रूमर्स, प्रोवाइड अप टू डेट इंफॉर्मेशन इन अ रीअश्योरिंग, ऑनेस्ट एंड एज अप्रोप्रिएट वे। दिस इज वेरी इंपॉर्टेंट। और ऑथेंटिक न्यूज के लिए बहुत इंपॉर्टेंट है कि आप ऑथेंटिक सोर्सेस को यूटिलाइज करें। मिनिस्ट्री ऑफ हेल्थ की वेबसाइट है और यूजीसी की वेबसाइट है, एमएचआरडी की वेबसाइट्स हैं, ये ऑथेंटिक न्यूज देती है। गो ओनली इनटू दैट। अनऑथेंटिक न्यूज को आप स्प्रेड भी मत करिए, बिकॉज इस वक्त आपको रूमर स्प्रेड नहीं करने हैं, नहीं तो पैनिक हो जाएगा। सो ए से ऑथेंटिक न्यूज पे आप भरोसा करिए, उसी से आप अपने एक्शंस करिए। एफ से क्या हुआ? फिट रहिए, मेंटल हेल्थ, फिजिकल हेल्थ, और फिजिकली एक्टिव रहिए, लेकिन रिलैक्सेशन मेथड्स भी करिए, पॉजिटिव सेल्फ टॉक करिए। आज जो होगा अच्छा होगा, आज जो होना है बहुत अच्छा होना है, 5 बार जब बोलेंगे अपने मन को, तो ये पॉजिटिव सेल्फ टॉक विल स्टिमुलेट योर पॉजिटिव थिंकिंग। और पॉजिटिव थिंकिंग से हर चीज, हर समस्या आपकी चली जाएगी, सॉल्यूशंस आपकी आ जाएंगी। और सेफ का ई से है एनवायरनमेंट। एनवायरनमेंट को सेफ रखिए, सपोर्टिव रखिए, सेंसिटिव रखिए और केयरिंग रखिए। फैमिली और केयर गिवर्स में एक कोहिजन बना के रखिए, विच इज वेरी 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 इंपॉर्टेंट। ये सारी चीजें जब हम लोग ध्यान रखेंगे तो आई थिंक कोरोना को हम लोग हराएंगे, जरूर हराएंगे। और ये जो लॉ बनाया गया है ये बहुत टाइमली लॉ है, लेकिन मैं ये जानता हूं कि हमारे लोग जब अपना स्ट्रेस मैनेजमेंट कर लेंगे, जब पैनिक नहीं करेंगे, तो ये जो अग्रेसिव आउटबर्ट्स होते हैं जिसकी वजह से लॉ के कई एक्ट्स को अमेंड करने पड़े हैं, ये सब भी नहीं करना होगा। और हम लोग सब साथ साथ मिलके, हेल्थ केयर वर्कर्स और सारा समाज मिलके इस कोरोना को हराने में एकजुट होके जब चलेगा तो हम जरूर विजय होंगे। आप सब लोगों को बहुत बहुत शुभकामनाएं फिर से। इट वॉज अ प्रिविलेज बीइंग विद यू एंड sincere regards to all. Thank you very much for your patient listening. Thank you.
Thank you very much, sir. It was a very wonderful lecture. That I hope that from the today onwards, the people will be very energetic and they will learn how to live in these crucial situations and how to keep themselves fit and mentally and physically both. How they can keep themselves fit and how they will move towards their happy life and happiness life. With these words, once again I would like to thank you very much, sir.